Thousands of rural communities in the districts of Pakwat, Nebi and Arua have seen hope and their health restored with support from medical outreach undertaken by Essential Medical Outreach and Treatment Rescue Emoter. The outreach helps in providing medical care through medical camps organized in communities, providing instant treatment to some diseases, and referrals are undertaken for those with complex complications. Dr. Lenka, the founder and chief executive officer of Emoter, highlights the essence of the medical camp outreach to the rural communities as a way of bringing medical care to Uganda.
My name is Lenka. I'm a medical doctor and I'm a founder of Emoter, Essential Medical Outreach and Treatment Rescue. And we are organizing medical camps in hard-to-reach remote rural areas of districts of Nebi-Arua and Pakwach for people who basically have very hard or almost no access to basic health services. So we bring the medical team with us, we have clinicians, we have even other volunteers from Europe, and we have something like mobile field hospital. And we start the work within the community, like in these rural communities, so they don't have to travel, because for many people it's also hard to get money for transport sometimes, and not only to reach hospital itself. Basically it works like a normal, let's say, health center. It's just outdoor most of the time. So the patient comes, he registers, he gets the form, he sees the doctor. Doctor may refer him for some laboratory testing, because we have also some simple laboratory tests with us. And then according to what the doctor finds out and how the patient complains, he will give him some recommendation and prescription. So we also have some small pharmacy with us with that basic treatment, because the purpose of this camp is mostly to treat these diseases that are very common within community. Basically, most of them is infections, either bacterial ones or like parasitical ones, like malaria, for example. Of course, we have some patients who need some other treatments. Sometimes we have it for, let's say, hypertension or diabetes, but it's not the main purpose of the medical camp. The medical camp is mostly here for people who would otherwise die for something that is very easily treatable. Yeah, like malaria, if the person doesn't get antimalarials or doesn't even see someone who can diagnose him in time, he can develop like big complications or even die. Yeah, so this is the main purpose of this kind of medical outreach.
What happens to those who need referral cases?
Sometimes we refer them, it is true, because sometimes they need some other either long-term treatment or some like follow-up. Sometimes depends what kind of disease it is. Sometimes they didn't even know about it. So this is just like that we find them and then we tell them like to go to some bigger facility because it needs like specialized treatment, which we can't offer like from the field for sure. But we usually follow with them later if they have issues, like with people from in Nebi we have some people with sickle cell, so they let us know if they need something. Some people, of course, they need like ultrasound scan, which we are trying to get now that we would have it also with us in the field. Some people for sure need sometimes even surgery or this kind of treatment plan. So, but needs for sure requires like referral hospital, yeah, which we give them referral and we advise them like to do this because there are still plenty of things we can't solve from here. But with that very serious cases, we are trying to follow up with them.
What has been the response from the community? Are they coming in large numbers? And what is the target maybe for this area?
They are coming in high numbers. We are also like mobilizing them in advance. We know from the district, let's say, which areas are in like worst condition, that like which areas, which villages, sub-counties they have like the hardest situation when they are trying to look for some help in medical field, or the facility that is nearby for them, they know that they are in red numbers, that they don't have enough people, let's say, attending prevention services, or there is a condition that there is untreated because they don't have enough of the medicine in that facility. So community know in advance that we are coming. So usually by the time we are here, they are mobilized together with the VHTs and with the local leaders here. And in one day, we can usually treat around 500 people like this, plus another around 200 prevention services such as immunization, deworming, or vitamins.
Okay, lastly, what has been the common complications or diseases you have discovered here?
Here, I think what I talked to the team, because I wasn't here for a whole day, we also just arrived a couple minutes before you, but they told me they had a lot of malaria cases here, which could either mean that it is because of the environment here, or because it's not completely the season for it right now, that in this area they have like actually way bigger issues, and like people have been suffering from malaria for a longer time, when we have a lot of cases in a time period that we don't really suspect it.
Okay. About the essential medical outreach, where is it located if somebody wants to do a follow-up? Or...
We have office in Nebi here, but like local leaders, they have contact for us, so if someone is there, like they can like look for us, because we are cooperating with the district. They know everything. We also have to give them report, so they can reach to us. We have website. We have offices on Google Maps, so they can easily find us, but the main office is only in Nebi yet we are thinking about making another branch maybe in Arua as well.
Stephen Bathowok, the co-founder of Emoter, says the outreach helps in accessing people who are unable to benefit from basic healthcare services from the existing health facilities.
I am one of the founders of Emoter. We started generally in 2019 and got incorporated in 2020. Basically, in a day, we target to work on between 500 to 700 people, and our target population is people in the hard-to-reach areas, like very far from the hospital, people that have hard-to-reach abilities that they can't move to the hospital, so we come and look for them in the communities. For example, like people like today where we are is almost 10 kilometers away from a hospital. So we think that by the services we bring, it can easily help them. So one of the services we do is laboratory testing. We give out drugs for free for pharmacy. We also do immunization for the kids and also HPV for the girls. We also do distribution of sanitary pads to the girls. We know that sanitary pads has been an issue. Yes, so basically that's what we do in a daily. The total number right now, as we are still working, is 580, the number that we have of people we have worked on. So basically, when we get someone that needs referral, we have a referral system. We have our cars. You've seen we have 2 cars that help us with the services while we are working. So when we get someone that needs an emergency service, like for example, a woman who is going to deliver, we provide them free transport. And also we provide the caretaker with some facilitation to help them for the day that they're going to stay in the hospital. And also, for example, with patients with sickle cell, what we do is we help them with the hydroxyurea, the ones that are on hydroxyurea, and then the others we enroll them in the sickle cell hospital or clinic that has the services for them for clear monitoring. And also we always take data for follow-up. For TB patients, we help them transport the TB samples. Then for HIV patients, we link them to the art clinics in the government hospitals. So basically, that's what we do for the referral system.
How did you identify the hard-to-reach areas, especially where we are in Lupi, Paris?
Yes. Now, the hard-to-reach areas, we have been identifying it by associating with the local leaders. Local leaders, we start with the LC, the LC1, the LC2. Basically here, like where we are here, we used the LC5 and he helped us to identify this area. And also we have a colleague who is helping us with a few background checks, Mr. the director of REMA, because we are planning a partnership with them. So basically they are helping us with background check. I think everybody knows REMA Foundation and REMA Hospital. So Emoter is partnering with REMA Foundation and REMA Hospital. So basically they are helping us with these background checks. They help us to identify, okay, find this area you're going to. We have this and this type of people. So we make sure that we take all the services that is needed.
What were the common diseases identified here in these communities?
Mostly it's the communicable diseases. Yes, we have communicable diseases that are common here. Also things like conjunctivitis is very common. It's one of the things we have found here. And a lot of people, due to the heat that is around, people have a lot of headache. So we have made sure that we cover up with these areas. Also there's been a challenge with immunization. So today we have immunized a lot of children. The total number is 253 and the number is still keep coming. We are immunizing children against tetanus, measles, polio and all these other immunizations that are for children. Also HPV for the girls who are below 9 years, we've been doing for them. We give them cards for follow-up next time when we come. So if we work here, we're going to come back after another 3 months. We shall come back to this place.
There are people in communities who do not want to access medical services, but also there are those who are satisfied with your work, will need to follow up. Maybe they want to access you. Where can they locate?
People who don't want to access the medical services, basically we reach out to the local leaders who go and try to advise them, and also we have health educators who are around. They are helping us with education and sensitizing people on the advantages of coming for the drug. But we have seen when we just came, there were very few, but after a few people going to speak to them, the numbers have increased. So we think there's a little bit of information that is flowing to the people. Okay, thank you. Stephen Watuwok. I'm a medical laboratory technologist and a public health practitioner.
Jimmy Amano is a community member and LC1 chairman of Ndriba village in Olupi Parish in Arevo sub-county Arua district, and explains the challenges the people face in accessing medical services in rural communities.
This issue of the medical service, it has been the long distance from the health center to our village, which has affected us much in our village. When we take the Kuluva hospital from our village, it is around 8 kilometers. And when we take Bondo Health Center 3, it's also around 7 kilometers from this village. This is a long distance. And indeed, in the service of health, it also affects us here much. When there are some challenges of health issues in our village, where you will find that when you transport somebody who is in need of the service, at the end you lose this person on a way while moving with the person to the health center because of the wrong condition of the road, poor condition. Otherwise, it is not good for our side. But for us as a village or the whole parish, we have actually given a land for the government to construct for us at least a health center too for our parish, but since along it has not taken place in our village here.
What can the elected leaders do about the road? For you, your role as chairman is to give your village work plan and parish work plan to the sub-county and district. Have they responded to your work plans?
They responded on a few areas, especially in our village here. When I look around, they only respond for the issue of the water. That is the construction of the borehole. We have the borehole in our village. But concerning the road and the health center, they have not responded.
About this medical camp, has it solved the problem of those who have issues, medical challenges here?
Yes, it has helped the issue of the challenge of the health here in our area in such a way that you will find there are some people who cannot even move. They don't have means to reach to the health centers. There are people who don't have, there are lame people in our villages here, where they have now taken this opportunity to come and get treatment in this service today.
What are the common health challenges you've seen here, common diseases in your village that people need the attention for?
I think the common diseases currently, which I have seen here, one is the red eye, which I have seen common in my village. Then secondly, is the issue of the malaria, which is still affecting the young children, even the adults. Even if the government has just been given for us the nets, the way how the community are using these nets, they are not using it in the right way. That's why you see that malaria is still amidst us.
Ronald Deo, the executive director of Rema Group of Companies and Healing Hands Uganda, explains the need for partnership with Emoter in providing and promoting medical service to hard-to-reach and needy communities.
So as you know, Healing Hands Foundation was initially called Rema Foundation. It's the NGO. I'm the executive director of Healing Hands Foundation. We are partnered with Emoter. As Healing Hands, our mission is basically to offer essential health services and then to promote sustainable development and uplift the marginalized sections of the community within Arua City and West Nile. So we are partnered with Emoter to ensure that our objectives are achieved. So right now, if you see Arua City, whereas there are good hospitals, you realize that not all services are offered. And there are also marginalized sections in the ghetto, in the slums of Arua City. So today we have come to close this medical camp, but sooner or later we're going to have another camp in Arua City. So basically we want to offer essential services to increase access to quality health care to all sections of the society.
How can we make this so frequent, especially to the rural poor, even we have the urban poor who cannot access this?
Right now we are creating more partnerships. Emoter is one of them. We're getting doctors all over the world, from European Union, from USA, from Ecuador, from Iran. So when we get more partnerships, we shall ensure that we make it a routine event, maybe after every 3 months, or even to increase it further. We're going to get volunteer doctors who are going to work with us on a daily basis. Government has already provided good security. We need support from the stakeholders, both in the local government and the community. Let's receive these visitors. Let's work with them. Let's give them an environment that can make them enjoy their work environment. Basically that. They don't need much. They don't need payment from us. So it's a matter of working with them and availing ourselves to partner with them.
Lastly, how can you make use of them, maybe to even give more skills or orientation to our existing
with them in the long run, we have bigger plans. This is just the inception. In the long run, the fact that we are very far from the city, we need to bring services which are not around, which are not available. So we are going to partner with them and improve services within the region.
My name is Volkan Duran. I'm from Turkey. In this department, my role is photographer. I'm taking some photos during these medical outreaches, and other than that, I'm also helping to pharmacy desk, immunization desk, vaccination desks whenever they need. The most common diseases that we see is mostly like malaria, conjunctivitis, especially in Arua district. There are lots of people with red eye issues. So other than those, they got like really big headaches, back pain, stomach ache. We are usually seeing those diagnoses on papers. And our purpose is like we are going to the areas far from the cities, so people cannot really easily reach the medical facilities, to doctors, to medicines. So we are just trying to reach them and guide them about their sicknesses, diseases, and we are just gonna try to provide some medicines for them. We are just trying to make the life better for them. Yeah, like we don't have everything, of course. Like some patients have asthma, and we don't have asthma medicine. And in this kind of situations, only thing that we can do, we are just trying to guide them. We are just trying to tell them like you need to go to a real hospital, because Also, some people have like inner issues, like intestinal issues, and we cannot monitor them because we don't have an X-ray machine, and it's not possible to bring it to here. There is no electricity here, we cannot work it out. So we're just trying to tell them, you need to see a real hospital, you need to go there, you need to put yourself in an X-ray machine, they need to monitor you. And like, we cannot do anything about cancer as an example, and we cannot find out if they have a cancer, because like I said, we don't have those kind of machines. We're just trying to make it easier their pain, and we are advising to please go to a real hospital, they need to monitor you. But this is the at least we can do. Yeah.
In terms of partnering with maybe local private medical groups or organizations in, say, Arua or Arua City,
Yes.
Can that be extended so that more other people or experts from your side are able to come on ground?
It can be extended. It depends to our bosses actually. We are just volunteers, but it can be extended. Like on these weeks, we are just doing these medical outreaches for 3 days for every district, Arua, Pakbaç, and Nebi. We can do it for more districts and for more days, but it depends to our bosses, and it depends to the fund from European Union. So they need more money, they need more supplies, and in this kind of situation, we can do it, I think.
Okay, lastly, what has been your observation? Do we need more funding from EU so that we can expand on this medical outreach?
Oh, I'm sorry, my phone. For this kind of thing, for that question, I think like as a photographer, I'm taking lots of photos during these outreaches, and also we got another photographer. We are also recording some videos in these areas, and we are sending these photos and these videos to EU, and they should see the situation from our photographs, from our videos. They should understand what's happening around here, and in this case, I think they should give like more money, and they should provide so much, like they need to invest in Uganda.
With the aim of changing communities and empowering them on best health practices, Emoter and Healing Hands Uganda have partnered to skill teenagers and youth to improve their economic status and make them self-reliant.